Where you at?
Alright, we're almost ready.
Where you at? Where you at? Boy, you said you would be for me. Where you at, babe? Where you at? Welcome. Olivia's just getting ready, and I'm singing a ballad about being ghosted because, bitch, do I have a story. Fucking strap in, double strapped.
Home and have a nap.
Don't nap because I've got some tea. I've got some fucking tea.
No, I'll wait until I get home to nap.
Stay awake. She's got a Monster and she's got a V. She's got all the caffeine ready for her.
I've already had too much, so
And on that note,
I think I should have that.
We are coming at you in the daylight today. What are the odds? Hello, my name is Georgia.
And I'm Olivia.
And welcome to Nurse Ratchet. So, you know how I went on a date?
Yes, with this man.
With this man. So, we went on this fucking date. It was a lovely time. Had a great time. He took me out to a steakhouse.
Yeah.
We got along, had some steak. He paid for everything. He was the, epitome of a gentleman, so to speak. Went back to his house.
It was charming.
Had a bit more fun. Actually a lot of fun. And that fun continued for about 2 weeks straight. It was very hot and heavy, very love bomby,
Yes.
if you will. Mm-hmm. But I was all about it.
Just enjoy it.
I was very aware that it was hot and heavy far too soon.
Really?
Yeah.
You were?
Yeah, of course.
Oh, okay.
This is not my first fucking rodeo, my friend. Mm-hmm. And I had a gut feeling that shit would hit the fan eventually, and hit the fan it did. And it sprayed all over those motherfucking walls, babe. Shit was everywhere. Anyway, there was talk about him being all in, quote unquote. He said to me one day, I'm all in. And I'm like, what does that mean to you? Exactly. I was like, what does that mean to you?
And he was like, after the trip?
Yeah.
When you said he was your boyfriend?
Oh, that was just me being fucking drunk. Anyway, he was not my boyfriend ever. He was like, I'm all in. And I was like, what does that mean to you? And he was like, I don't know. I was like, great. And he's like, are you? And I was like, well, if you don't know what all in means, how the fuck would I know what all in means? And why are we even having this conversation 2 weeks in?
What the
Anyway, he got a little bit butthurt. But anyway, he was like, no, it's fine. Or whatever. But those were the conversations we were having, right? Fast forward to Friday, right? It's now Monday. I message him as we were doing. We were doing daily messages and there was no response. There was no read receipt. There was just delivered. He left me on delivered.
Didn't even
I was like,
open it.
okay, whatever. Like a couple of hours go by. I message him again. I'm like, because this is not how he was. He used to always text me back pretty quickly. I was like, what's going on? Why are you MIA? No response. I wait for the next day. I just let it go. I'm like, okay, whatever. Maybe he's busy. Next day, the whole day goes by. I don't text him. The entire day goes by, all of Saturday. Nothing, no message, hasn't even read my messages. And then Sunday rolls around, which was last night, and I realised I'd left my jacket at his house because I'd already gone, okay, so he's not reading my messages. He's clearly alive. I did ghost call him a couple of times with no
what does
ID.
that mean? Oh.
No caller ID.
See if they pick
To
up.
see if he'd pick up, but also to see if the phone was on, and it was. Right? Did some
might be
investigative work. That's what I thought. I was like, he might be dead. If he's dead, he won't have charged his phone. Right? Not dead. I went to the most logical conclusion, which is he's still alive. Anyway, I then message him and I say something along the lines of, okay, well, I'm clearly not going to continue this because clearly you're ghosting me. Your phone's on, so you're fucking alive. So that's good. Anyway, can I have my jacket if you ever find your fucking phone? You can just leave it outside your house and I'll pick it up and we can go our separate ways because clearly you don't want a bar of me anymore and that's fine. Would have appreciated a fucking message and a reason as to why because you were so fucking hot and heavy 2 days ago, cunt. Anyway, a couple hours go by. I'm about a bottle of wine in and, I just try to call him one more time because I really want my jacket back because my jacket was given to me by my children. It's not the fact that I like the jacket or anything. It has sentimental value and I wanted it back. I call him. He doesn't answer, but he then responds to all of my texts and said, I said something along the lines in the text message, you clearly don't respect me enough to give me a fucking answer. And he just responds with, I do respect you. And I was like, cunt.
Oh, God. He's got no brains.
Zero. Where's my jacket? Like, he's like, how much was the jacket? How much do you want for it?
What?
I was like, oh, bitch, you better not be telling me that something's happened to my jacket. Or he just doesn't want to see me. Okay. I'm like, fucking drop it at the front of your house. I will pick it up. I don't care. I don't want to see you either, cockhead. And I was like, what? Did you get rid of it? He's like, I didn't get rid of it. My crazy ex took it. Crickets. I beg your pardon?
What the fuck? Why is he with his...
Come again? I was like, well, that explains the ghosting. You were with your fucking ex.
Yeah.
Cunt.
Yeah.
Anyway, he does have a child with this woman. So...
Wait, did you know this?
Yeah, I knew that.
Oh, okay.
I knew that. Yeah. And I knew that she was quote unquote crazy as per him.
Are.
As per him. Anyway, she has my jacket apparently. Like, okay. I said, are you fucking serious? Fuck? And apparently she chopped up all his clothes and stuff. That's how crazy she was. And I was like, is this bitch gonna fucking ruin my jacket because she's crazy? Or both of you are crazy? Anyway, I was like, fuck you. I raged. I was like, fuck off. I said, you better get me her number or my jacket tonight. Tonight.
Is that tonight?
Last night. Long story short, he goes, I'll go and get the jacket. I was like, great, you do that. Anyway, he ends up coming to my house and dropping off the jacket at 1 a.m.
Oh.
Yeah, no, not. He was like, I'm here. Should I come up? I fucking race down in my gym jams and he's looking at his phone, doesn't look up, and I like bang on the window on his fucking passenger side. I was livid and tanked as well with wine. Probably about 2 bottles at this point.
Shit.
Yeah, no, I was binge drinking, bitch. I was so annoyed. He jumps. He goes, oh, he does a little jump scare.
Good.
He opens the door and he's like, hi, how are you? I was like, bitch, give me my fucking jacket.
Just fuck off.
Give me my jacket. He hands it to me. He's got this sad sack looking on his face like, oh, I'm a sad little puppy. And I'm like,
pet me.
He was like, how are you? And I said, I'm not fucking good. I am not good at all.
Why do they always ask that?
Oh, and I was like you even give 2 shits about how I am. I just ended up grabbing the door and slamming it in his face and marching back up into the house.
The car door?
The car door.
Oh.
Yeah, don't fuck with me. I'm a Taurus, so if you rub me the wrong way.
Especially when it's got to do with your children.
Yeah, I mean...
That's next level. That's times 100.
Yeah. And also, don't
going to bring out the worst and the best in children.
Yeah. You're going to bring out the worst. And if you do bring the worst out in me, you fucking deserved it.
Yeah.
So I march back up and he sends me a text. He's like, oh, he goes, I just want to be in bed with you. And I said, I bet you do. Fuck you. And he goes, even if it is just for one night. Romeo.
I was just about to say, this is such a romantic little story that he's painting a picture of.
I'm like, bitch, I am not that desperate. Yeah. I said, do you really think I would lower myself to that level at this point?
Men don't understand how abundant dick is. It is abundant everywhere.
I mean, period.
For women. Like, men fight over who gets to fuck us.
And so he's like, I'm almost at the freeway. And I was like he was wanting me to say, oh, come back. And I was like,
what the hell? Yeah, he's testing you.
And I was like,
last chance.
I said, great, keep going.
Yeah, which freeway? Is it the freeway like up in Queensland?
The freeway to hell. Oh my God.
Well, the nerve.
He's like, I'm sorry, I know you're upset. I was like, I can't be with someone that treats me like this. Who gives my fucking belongings to his ex? Like, what the fuck is that?
Why was she even there in the first place?
Yeah.
Why are they in communication?
Yeah.
If she's that crazy, oh, well, I guess they have a kid together.
They do, yeah.
But I was going to say, why don't you just fucking block her? But if they've got a kid together,
it's complicated.
Different.
But at the same time,
but
why
also,
are you letting her in your house?
Yeah, like have boundaries.
Why did you let her walk out with my jacket?
Yes.
Even if she was there for some reasonable reason, why are you letting her steal my shit?
Unless he doesn't want to like grab the jacket from her, right? Because then what?
It'll might kick
call
off.
Abuse. Something.
Yeah,
right?
maybe.
If she's that kind of person, that's potentially what she could do, right?
Yeah, but
you know,
that being said, I don't
bullshit.
want anything to do with that shit. Yeah. I don't want that fucking drama in my life. No. I said, you ghost me for 3 days and act like a dumb fuck when you're eventually contacted. Yeah. Unreal. You really must think I have 0 brain cells. Good luck to you. And that was my last message. But
nice. No response?
No. Good. No. Good. He didn't want to get his ass handed to him anymore, I think.
Yeah.
I think he realised he wasn't going to get his dick wet that night and just called it a day, you know.
Go find someone else.
Yeah, please do.
Not that you've got, like, any options, really, but...
Well, you've got one option. Apparently, she's batshit insane, so enjoy. Enjoy!
Yes.
So that was my nightmare fuel. And on that note, do you have any nightmare fuels?
This is the Nursing Nightmares episode that we're doing now?
Sure is.
Okay, cool. So this morning, my partner picked up a short shift at one of the hospitals, and it was like 7:30 to 1:30, so we'll be finishing very soon. Anyway, I took the girls to school again. So I get up, and it's like 8:25. School starts at 9, yeah. I would have thought that, like, because Max, you know, he puts out the breakfast. So he got, like, the cereal ready and their bowls and spoons and stuff. So they pour their own cereal and they get milk out of the fridge. Anyway, it's 8:25 and they're, like, not dressed at all. And they're, like, haven't even started making breakfast. And usually they're up at, like, 7:30 and they're, onto it.
Oh, dear.
And for some reason this morning it was 8:25 and they were, like, absolutely just easy breezy loving life.
It's a day off.
And I'm like, girls, you see the time on your clock in your bedroom, yeah? It says 8:25. We need to leave at 8:50. So that's in like 25 minutes. Yeah, we need to like be a bit quicker. Anyway, so this was my morning. Half of the fucking packet of rice bubbles was spilt all over the table and the floor. And
sensory nightmare.
Yes, and then the crunching that was happening under their shoes was great.
No.
It was great.
Absolutely not.
Our kitten also is an absolute menace, yeah. So he had like taken out the bathtub plug and like put it on his like scratching toy that he got.
Fuck yeah.
And he's like been picking up my makeup brushes out of my makeup container in my bedroom, and he'll like pick them out one by one and take them to the floor and chew on the brush bristles.
Fuck yeah.
So I had 4 makeup brushes on the floor this morning that were fucking soaked with cat saliva.
Excellent.
That I woke up to. And then the girls went and eaten, hadn't got dressed. Anyway, suddenly, like out of nowhere, they're like ready to go out of nowhere. I don't know how the fuck they do it. And it was like 8:45 and I'm like, oh my God.
Period.
Wow. Maybe you can sit on the couch for a bit and just chill and do something.
Yeah, we've got like 5 minutes left.
Yeah, so they sat down and read a book. And then I feel like every time I take the girls to school, it's just like a whole new shitstorm. Something new happens every time. Anyway, yes, I woke up and there were also a whole trail of ants going to the cat food bowl because we haven't cleaned it for a few days. We got a little bit lazy and the ants have taken over.
Absolutely not.
And they're like coming out from a little crack underneath one of the walls in the bathroom.
They always come out of a crack.
This apartment is the worst built thing I've ever seen in my life. Anyway, so the girls like, oh my God, I can't put my shoes on or my socks because they're covered in ants. Because the ants are just like fucking everywhere. So I had fun cleaning up the ants because I had to like clean them before we left for school. Yeah. I got home after dropping off the girls and I just start like looking at all the mess really closely. You know how sometimes you do that and you're like, oh my God, there's like, and you just see more and more things as you look. More and more. There's more things to clean. The apartment was so clean last night, and in about 45 minutes this morning, yeah.
Oh, it is the worst. The kids will do that.
It's the fucking rice bubbles, I tell you.
Oh, fucking rice bubbles.
And the bloody ants. I get home and I'm just looking around and I'm like, oh my God, so much to clean. And I see this lovely thing on the wall of the kitchen door. And this just brought me back to my childhood. I fucking tell you right now. Brought me back to my childhood.
Was it snot? Mm-hmm. Oh my God, how did I know?
I said to Max, there's this beautiful, lovely snot that one of the girls has so lovingly put on the
bit of a finger
kitchen
painting.
Door for you there.
Oh my God.
It's rounded.
It's black.
It's dark.
Oh my God. That's a nightmare.
Anyway, look at all these snots. There's another one.
Oh.
There's another one.
No.
There's another one, guys. And there's another one.
It's either snot or feces.
And there's a lot more where that came from. Anyway, I sent the photos to him and he's like, fuck, I really don't want to come home now. Anyway, so when he gets home later and he picks up the girls, they'll be doing some snot cleaning.
Yeah, great. Perfect.
Because that's fucking disgusting.
Yeah. And that's children. Look, children are just grubby.
I'm really curious to see what next morning I take them to school will be like.
Fucking hell.
I bet you one of them will have a fucking asthma attack and one of the others will fucking break break her arm and die or something. Like, it'll
Probably.
just be the most catastrophic morning in existence, I bet you.
Probably. Touch wood, that doesn't happen. But that's parenting, my friend.
Yeah.
Just so you know, that's a normal occurrence.
And I'm like a quarter time, half step parent thing. And it's just like...
You're quarter timing and you still have to deal with fucking rice bubbles, ants, and snot. Period. Work. All right. So our first nursing nightmare fuel is from Caitlin.
Yay.
Thank you, Caitlin. It's called Horrible Shift as a Student.
Uh-oh.
I know.
The best.
Hi all. Here's my story about my second shift on a heavy acute vascular / gynae / ophthalmology / ortho surge ward.
Okay.
Wow. There's a lot there.
You're a jack of all trades then, clearly.
Clearly, yeah. So I was allocated a buddy nurse who was working 1 to 4 all patients in single rooms because of precautions due to a gastro outbreak on the ward. Nightmare fuel number 1.
No.
We hate a gastro outbreak. That's a fucking nightmare in itself. One patient was quite old and ill, was admitted for an ulcer that needed surgical clearing out and had a vacuum dressing in place. During a routine round of obs, I noticed this patient was quite fatigued and had been increasingly so all shift. The blood pressure came back 90/50, hypothermic with a temperature of 35.2. I immediately went to tell my buddy nurse and came in and checked again after saying, "Are you sure? Did you check it manually? I really can't be bothered to gown up." Oh, nice. Period, buddy nurse.
Try again,
Standard.
Try again.
Love that support. She checked it manually and it was 80/40, so even lower again, so a Met was called. My buddy nurse left me in the room alone to answer the doctors while she went on her tea break.
What? I thought you just had a Met call.
Yeah. What? She's like, nah, fuck that. Tea break. Period.
Can't miss it.
No. The nurse in charge ended up coming in and helping me as I was completely overwhelmed and not in a position that a student should ever be put in. I mean, yeah. Like, how are you going to answer the fucking doctors with your student knowledge? Nothing. You're not going to be able to. I could barely speak to doctors when I was a student.
I know.
I was so scared.
What the hell?
After her break, the Met had been resolved and I had gone on my dinner break.
Oh,
Like,
convenient.
good for her, yeah. The nurse in charge had told me to take a bit longer to debrief in our diary. When I returned, I was immediately told off by my nurse for not taking OBS every 30 minutes post-Met. This was not something I knew. I went to go take them and the patient became incredibly aggressive towards me and told me to fuck off.
Why?
So I went and told my buddy nurse, who said, "I don't care what they've said to you. I'm telling you to go do them goddamn OBS." Crickets. Feisty.
Bitch.
How rude.
Fucking rude, yeah.
I would have cried. Anyway, the nurse in charge reported her and she was no longer allowed to have students. But even when working on her ward, this lady scares me. On another note, the ICU nurse who came to the Met call was another clinical facilitator working a normal shift who wrote my facilitator a glowing letter about me and how well I did under pressure.
That's nice.
The end. How nice.
Yeah, nice.
There's always a bad one in every bunch and then there's always a goodie.
Yes.
Yeah. People like that shouldn't be in nursing at all. Like, let alone have a student.
Yeah.
Like, I told you to do the goddamn obs. I beg your pardon, who the fuck are you talking to? Yeah. She's not your fucking minion. She's not your slave.
Yeah, a lot of them treat students like their little fucking assistant.
And they take advantage of your lack of knowledge and experience and fucking treat you like a piece of garbage and think they're going to get away with it or think that you won't report it because you're not educated on how often you should take obs after a Met. Like, get fucked.
How are you meant to know? And also every hospital's protocol is probably different.
Get so fucked. Also, you're supposed to be supervising everything she does.
Yeah, and you're meant to be going on break together.
Yeah.
Unless someone else takes over the supervision temporarily.
Exactly. She's not there to cover your fucking break.
Yeah,
cunt.
why is she covering your Met call?
Yeah. Is it because you're not fucking educated
Are you
enough to
terrified?
handle it on your own?
Yeah, no, I've got to run off to my tea break because I can't be involved. Like, what the hell?
Yeah.
Dude? You should have been like up in front centre.
Yeah.
That's your
leading
patient.
the fucking way and leading by
telling
example.
the doctors exactly what's been going on. And you should be aware of exactly what's been going on because it's your patient.
Yeah. But
Even
you didn't.
if it was the student
That's
doing
why
the
you
obs.
bailed.
Yeah.
That's why she bailed.
Yeah.
She had
I've
no
got a
fucking
feeling
idea.
She'd
Anyway.
be fucking fired.
I mean, yeah.
How do you get away with that?
There was disciplinary action, so that's something,
Good,
I
good.
guess.
That reminds me of this nurse that I had grad year. Anyway, she was basically a nursing educator with this other girl. And they were both ED nurses, and this older lady nurse was also ICU trained, or so she fucking claimed. They always love to claim that they're ICU trained, don't they? This woman she was very proper and posh. She had like blonde bobs. She'd wear like, black mascara, reddish lipstick, and she'd always have her nails done, like fake nails, rounded, long and red.
Illegal. Yeah. Hashtag.
And she'd always wear like black skirt, like black heels. Like she was very, this is her. I couldn't zoom in on the photo.
Yeah, she looks like a Karen, period.
Yeah,
I had to look at her for about 0.2 of a second.
Yeah.
I knew.
Yeah.
I knew.
Anyway, so she was the educator for that.
Of course she was.
Yeah, that year, or a couple of years.
With her nails and all.
Yeah. And she was so like aggressive and like anal about everyone not having any nails done or like not wearing any jewelry, makeup, whereas like she was just
rocking around with a full set.
Yeah, I know she's not working in a clinical environment in that moment, but you are meant to be a clinical like nurse educator. So yeah, leading by example. And like when you're going to see students in the area, you should conform to the same standards. Anyway, she was such a bully is basically my whole point. She was such a massive bully. There were multiple reports made about her over time, but she just kept getting away with it for a bit. And then she got fired basically because finally there had been enough serious complaints.
Nice.
And she'd made like so many people cry.
Ugh.
She does know her shit. I'll give her that for sure. She does. But the way she went about it was so fucking elitist and just
also
so
on a power trip.
Bully-like.
Yeah.
Yep. That is not a productive way to teach people and help people learn.
Not at all.
I don't know. She had a fucking nickname, the fucking devil.
What was it?
Oh, the devil or something like that. The Red Devil, whatever. I can't remember. Red Devil. This was fucking years and years ago. This is so long ago. Because of the red nails and the red lipstick and she had fucking red heels.
Did she get around with lipstick on her too?
I think so. You can't wear red lipstick without getting it on your teeth.
No. Righto, next story.
Should I read one?
Yes.
All right. This is a spooky story regarding aged care.
Fuck yeah.
Hi, Georgia.
Hi.
And Olivia.
And Olivia.
Serena here. I was working at a residential aged care and was doing my first night shift. One of the nurses I was working with said, "Oh, God, he's back again." I said, "Who?" And she must have thought I knew what she was talking about, but being new, I had no idea. The man in the top hat, she repeated.
What?
The man in the top hat. Turns out she can see spirits, and there's a man in a black outfit in a top hat who always lingers outside the door of one of the rooms and just watches everyone and is so angry.
Creepy.
Later on, one of the residents asked, "Who's that man on my bed?"
What the fuck?
We saw nothing, and she got a bit frustrated and asked again, "Who is that man with the hat on my bed?"
Oh my God.
Also, there were children's laughter, but being an aged care facility and not within visiting hours, there were no children.
Nope, absolutely not.
That's fucking
Hard
creepy.
pass. Fuck that, I'd be out of there.
It has been told to us that the land the aged care facility is built on was a very special area of land for the Aboriginal and Torres Strait Islander people.
Oh.
And it's thought the children come to play and there are some upset spirits. Also, nurses have reported feeling taps on shoulders and feeling other sorts of emotions and feelings.
Wow. Crazy. Is that it?
Yeah.
Oh, thank you, Serena. That's wild. I'm desperate to have, well, not desperate, but I'm keen to have a little paranormal encounter or experience, but I don't want to be scared. Ooh. You know what I mean? I want to be like, ooh, that's freaky, but not like terrified. Boards? Yeah.
We used to make them in like middle school,
yeah.
Fuck around.
Yeah. I had a teenage party Ouija board experience when I was about 15 or whatever. We had a sleepover, a bunch of us girls, and my best friend at the time, her mum had passed away. And so I don't know whose Ouija board it was, but it turned up at this party. Yeah, we used to shot glass on the Ouija board because we didn't have the little pointer thing. So we all put our fucking finger on it and the cunt started moving. And my friend, she was like fucking shivering, like she couldn't keep her finger still because she was so scared.
Well, that's probably why I was moving.
I can't even remember.
You're all moving.
Yeah, well, someone... I don't know, but we all just had our fingertip on it, like the tiniest little tip. Like there was no pressure behind any of the fingers. I was surveying. I was like, who's pushing this cunt? I can't even remember what it said. It was so far back, but yeah, we were terrified.
What did it spell?
I don't know. I can't remember. We were terrified though. Yeah, we quickly stopped.
Oh
But
my God.
it did move.
Holy shit.
I know. I have a theory that a lot of hospitals would be haunted, like given the amount of people that die in them on the daily. You know?
Do you think ghosts are real?
Kinda.
Yeah.
Yeah. On that note,
Some sort of afterlife?
I was saying to the girls on the girls' trip that my daughter, I think, has some clairvoyant abilities. And this happened the other day as well, 2 nights ago. She comes into my room and she goes, Mum, someone just poked me twice on my back. I'm terrified. I was like, what? And before
She's not
that,
having like tactile hallucinations.
well, maybe. I don't know. Maybe she's got a fucking brain tumor. I don't know. But she's also heard knocking on her wall multiple times. And what else? She has had experiences where she feels full-blown body shivers when she's thinking about the kittens when they died. And it could be an anxiety thing, but she's always been a very intuitive person. She really knows. She locks into what you're feeling and knows. She'll pick up on things. She picks up on the vibes, and she's a very emotional person. But like, there's been a lot of that in this house. And before we moved in, the previous tenant was an old man, and he died in this house. So I wonder if she's in the bedroom where it happened, or this old man is just saying hello to her. Yeah.
Does she have any relatives that have passed? Like, do you guys have any relatives
Yes,
close
grandparents.
that have passed away?
Yeah,
Grandparents?
my grandma
How long ago?
recently.
Well, no, I mean, like, both of them. I know your grandma was very recent, but
Yeah.
grandpa or?
Yeah, he died shortly after.
Oh, shit.
Yeah.
I forgot about that.
Yeah.
I remember your grandma.
Yeah, 2 grandparents in like 1 month.
Any other family members that have passed?
No. So, yeah, interesting. So she's being poked now, ladies and gentlemen. So I went in, I go into the room and I say a prayer over her and stuff, and I say, if anyone's in here, could you please
Go away.
leave my child alone, because she doesn't like it and you need to stop. And she's fine after that usually. But yeah, weird.
Okay.
Keeps happening. Anyway, moving on.
Well, that reminds me quickly. One of my auntie's best friends, she's no longer alive, but my auntie and her were best friends since their childhood. And this lady, her name's Eve, she has always claimed to experience
paranormal
things
stuff.
like that. Yeah. And my grandma also, my dad told me, that she, years and years ago when they were young, she woke up one night in the middle of the night and just knew that her husband had passed away.
Yeah.
Even though he was in another country at the time, he was still in Serbia, and they had come to Australia.
Yep.
And she woke up in the middle of the night and called her sister over there.
Yep.
And said, "Is he dead?" And she's like, "What the fuck are you talking about?" Yeah, lo and behold, he'd passed away in the middle of the night.
It happens. I've heard multiple stories like that.
But also, my auntie's friend Eve, she said that when she saw my grandma pass, because we'd been at the hospital for like a few days. My grandma had had a couple of heart attacks and they'd put her in hospital, and this is the final straw, right? She's 91 almost. Anyway, so my dad had come back from Geelong Hospital to come pick us up, and I was in year 10. And as soon as he walked in the front door, he got a call from my auntie saying that my grandma had passed away. Yeah, so my grandma, when she passed away, apparently Eve saw a rounded white light come down through the ceiling to my grandma's bed and basically like pick up her soul and go back up.
Is this in a dream, or was she?
No, this was in the room at the hospital.
Oh, wow.
Yeah, like a couple of minutes after my grandma was had stopped breathing, and they noticed, and they went to get the nurse before the nurse and the doctor managed to come into the room. A couple of minutes later, in those 2 minutes, that happened. It was like something came and took my grandma's soul up to heaven. Aww. And I don't believe it at all, but a part of me does. Because why would Eve lie? She had been one of
She's not
our
that type.
family friend
Yeah.
since
She's not that type.
forever.
Yeah.
Why would she lie? And she never said anything that was like super outlandish.
Yeah,
Like
yeah.
she told me some stories that she'd had various experiences with friends, family members that had passed away from certain things. And so I just have no doubt that why would she lie? Seeing this thing
Yeah.
come and
Yep.
basically like pick up my grandma's soul and take her with
Yeah,
it
wow.
up to heaven. Like
That's beautiful.
right? Anyway,
I believe in signs and things like that, and I believe in spirits. I believe in God. When my grandma passed away, she got cancer over COVID, and so it grew and basically took her out. And when she was dying, I went and visited her in her home, and she was giving away some of her belongings, and she gave me a silver bangle with a dragonfly on it. And then the morning of her funeral, I was sitting out by the creek in Mansfield when I was with Tim, and I was just watching the creek, taking a moment, and all of these dragonflies just came down
nice.
and landed on the river. And I was
Beautiful.
like, it's a sign.
Well, that's nice.
It was real nice. And I was like, oh, you're just letting me know that you're okay. Alrighty. This next one is from Hayley. Hey, Hayley. It's titled Healthcare Horror Stories from a Baby Ambo. Hi, Georgia and Olivia. I've just found your podcast and I'm loving it. It's so awful yet relatable to hear. To hear your nightmare stories about healthcare. I'm only 3 years in the job as a paramedic and have so many stories from preceptors, management and patients that if I don't laugh about, I'll probably cry.
Oh,
She's got like 4 stories.
wow.
So maybe we can take in turns.
Sure.
Story 1. I did my double degree in nursing and paramedicine at uni and had this one particular nursing educator who was proud of the fact that she made students cry on the reg at placement. Maybe it's the same fucking bitch.
Oh, I wonder.
Oh, she was a huge contributing factor to the reason why I didn't go into nursing after uni. This all occurred on my second shift of this placement. Several times throughout this one shift, she berated me in front of patients, fellow students and nurses on the ward, to the point that I burst into tears and thought that I was the problem. Unreal. This was my second ever placement and had not had the hang of handovers yet, and she felt that my poor handover skills was the hill to die on instead of offering me help on how to improve them. She also ripped into me over the fact that because my buddy nurse was on the Met team on the morning of Met calls, I'm taking 3 or 4 back-to-back and haven't seen her since saying hello. And we hadn't had the chance to have me take a patient load because I was looking after all 5 patients on my own while my buddy was in Met calls.
What?
Oh,
Why were you partnered up with her?
this is what I'm saying.
This is
Fucking
so
students are used
wrong.
as just extra staff.
Yeah.
And then they're reprimanded for it.
Yeah.
As she was my educator, I felt like I couldn't report her bullying to anyone and just put up with it for the next 2 weeks.
Because they're the ones that you're meant to report to.
Yeah. She destroyed my confidence as a nurse and taught me a lot about the type of healthcare people I don't want to be, especially to students and new grads. She was supposed to be my educator on a different placement, but thank God she got reassigned because I was so anxious going into that placement. Another preceptor who I was assigned to on my first day of placement huffed and rolled her eyes at me and said, I don't have time to deal with students, just stay out of my way. What the fuck?
Wow.
As if I have a say in who I'm buddied up with. I think a lot of nurses forget that they were once learning to. The nurses eat their young culture was a big contributing factor as to why I didn't head down that path, which was sad because I had spent 4 years at uni absolutely giving my all to unpaid placements and unhinged workloads to be burnt out before I'd even got on the floor.
Yep.
Period.
We used
girly.
to do like 9 shifts in a row. 9 days in a row.
Yeah, it's fucked. And
As
they
a
wonder why we're
third
zombies by
year-
the end of it.
Yeah.
All right, story 2.
Recently, we were called to do an IHT. What's an IHT? Intra-hospital transport or something, maybe.
Maybe.
Transfer. For a patient who we were told had a chest infection but needed to be transferred to a bigger hospital. It wasn't the hospital in our area, so we had to travel an hour and 20 minutes to get there. I was working with a new grad paramedic who was an absolute gun of a clinician. but shouldn't have been put into the position she was placed in. We walked into the hospital and immediately could hear how unwell this patient was. Like I'm talking, they had him laying flat and I could hear his breathing before we even walked in the door.
First question, why is he flat? Anyway, continue.
We were handed over that our patient was completely stable for transport. He most certainly was not.
Doesn't sound like it, no.
When discussing treatment and transport for our patient, I said to my grad, we might do lights down to the destination because he looked like shit.
Yeah, so lights and sirens. So
lights down as in put them on?
Yeah, lights and sirens, yeah.
Okay. The nurse who handed over to me scoffed and told me she didn't think it was necessary and that paramedics abuse the use of lights and sirens for anything.
Love that.
And spend more time using them for coffee.
Oh, for
than
fuck's
we do
sake.
jobs. I think
Shut
paramedics actually work harder than a lot of us nurses do sometimes.
Oh my God.
They do 16-hour plus shifts a lot of the time.
They do it a lot.
And they're on the road. It's just them two.
Oh, the audacity. Shut the fuck up, Karen. Oh, moving on.
Wow. She then gaslit me and made me second guess myself about this patient because he's an unwell man anyway. Okay, that doesn't mean you leave him to be fucking unstable.
Period. Yeah,
You still
just
gotta
fucking
help
let him
him.
die in the ambulance. It's not your problem, is it,
The
Queen?
hell? During transfer, the only cannula we had was dislodged, which she laughed about. Of course. We were handed over that all OBS were within normal limits. Spoiler alert, they most definitely were not. This patient had a systolic blood pressure of 73 and
fuck
all
off.
other OBS were pointing to signs of sepsis. I was about to say.
Yeah, wow. No shit.
Coupled with his breathing and stuff. Our only access had been dislodged, and as this patient had extensive lymphedema on all his limbs, oh my God,
Heart
we
failure.
could not get another line in him for fluids. He couldn't be laid flat with legs elevated because of his breathing being awful. So our only option was to basically put him in a V position and absolutely gun it down to the next hospital, which was an hour and 20 minutes away.
You go, girls.
I absolutely belted it and got us there in just under an hour.
Fuck yeah.
Nice. He did improve marginally with the oxygen and elevated legs that my amazing grad had implemented, but then deteriorated and had to be retrieved to yet another hospital from the one we transferred him to.
Yeah.
In hindsight, what I should have done is turn the patient back around into the ED and demanded that he be assessed by a retrieval team.
Yep.
This is in a small country area, so the ED didn't even have a doctor in it.
Yeah, it's fucking urgent care probably.
They're mostly run by nurse practitioners or
And
nurses.
just nurses, yeah.
But being relatively junior in the job, laughed at for even suggesting an urgent transfer made me second guess myself.
People can sniff out a new nurse or clinician from a mile away and they just take advantage of it.
It's the way they carry themselves. You can tell when they're a student or a grad. It's just the way that they have like their whole body language.
They just hesitate because they don't want to be wrong.
Yeah. Oh my God, don't we know that fucking feeling? Terrified to say something wrong, give the wrong answer, because what will happen? You'll be berated in front of all your...
humiliated publicly.
Fellow students or the patients or other nurses.
Yeah.
Many times I was fucking screamed at in front of patients.
Yep.
It's just absolutely ridiculous.
I've been screamed at too.
Yeah.
It's fucked.
In front of patients.
In front of a patient, 100%. So sorry that happened to you and good job getting your patient to where he needed to be.
It sounds like you give a fuck.
Yeah. All right, story 3. This one is an unhinged thing. A patient has said to me, we went to an older man who was complaining of pelvic pain post a pelvic fracture a few weeks ago. He was also showing signs of a UTI. And as it was the weekend, we decided to transport him instead of referring to his GP. Good call. During transport, he turns to me and says, so do you girls just do the little jobs like these and leave the big car accidents and cardiac arrests for the men?
No.
Crickets. Oh my God. He could not fathom the fact that I, a female working with another female paramedic, was just as qualified as any other man on the station to attend quote unquote the big jobs. Another man also had the audacity to comment on the fact that I had a few breakouts on my face and got offended when I said, what an odd thing to say to someone you've just met. Like, sir.
Yeah. Wow.
You go, girl. Another patient, when getting him off the stretcher, had a buckle strapped across his crutch. I said to him that he could undo that one, and he gave me the creepiest smile and said, aw, can't you do it for me?
Ew.
I deadpanned him. No, it's across your crutch. And he got angry with me. Oh, they always get angry with rejection, don't they?
Touch me
How
where
dare
my
you reject
penis
me?
is.
After the interaction, I told my partner, and she then informed me that the patient had spent the entire time trying to look down our tops. This was in front of his wife and children too. What a revolting
What the fuck
man.
is this guy doing?
Just a reminder to the general public, Healthcare workers are not there for your sexual fantasies or for your perversions
They're
or
doing a
for,
job.
you know, any kind of sick amusement you might have. You know, we're there to help you, but we're not there to fucking, you know, indulge your sick fantasies.
I've had plenty of weird fucking comments from guys.
Yeah,
Never,
always.
ever have I had a weird, uncomfortable comment to me made by a woman.
No.
Ever.
Isn't that interesting? I'm quite a short person and often get the, oh, how lovely, a little girl doing such a nice big job like this, as well as questions about if I'm actually allowed to drive the ambulance. Meanwhile, she's gunning it down the highway at 120 k's to get these cunts to a fucking hospital.
Wow.
Oh, my God. One time, a patient was genuinely concerned that she thought I was 15. I laughed and reassured her that I was, at the time, most definitely 23 years old. She then asked, so you're married? Kids? And when I said no, turned to me and said, well, you'd better get onto that. Oh. As if 20 seconds ago she didn't think I was a minor.
Yeah, what the hell?
It's like, oh, you are of age? Why aren't you popping out kids?
Yeah, why aren't you pregnant right now?
Why are you focusing on your career and not how many kids you can bring into the world?
Let the men do that.
How rude. Yeah, go home and stand in the kitchen. Fuck ya.
Make a sandwich.
When I said I don't plan on having children, she looked so appalled, as if I had just spat in her face, and spent the next 20 minutes trying to convince me as to why I absolutely should have kids. It unsurprisingly was unsuccessful, and I am still happily child-free with zero plans to change that. Period, queen. You go, girl. Take out that uterus while you're at it.
Free. I probably get this a couple of times a week, I would say, at work. So, have you got kids?
You got a husband?
Yeah. You married? Or, and I'll tell them, no, but like my partner's got kids. I'm like, oh, but do you want your own? Why don't you want kids?
Yeah, I know.
And then it's a whole snowball.
I know, and it's just like, can we just focus on your care?
Trying to...
Please.
And then you get all the questions. So when are you going to... Never. Fuck off. Why do you care? Why are you even asking me? When hell freezes
over.
I will never pop one out. In fact, I will pop out everything else inside me before I pop out a baby.
I will squeeze out my own uterus.
I will... No, just good riddance.
No, thanks. I had this one patient in recovery, old man in his 50s, try to convince me that I will only be happy if I was married to a man.
Yeah, they go, what are you going to do if you don't have kids? What are you going to do if you don't get married? The same thing I've always done forever?
I said to him, I'm quite happy at home, alone, with my 2 children and 5 pets. Yeah. Thank you very much. And there was a nurse next to me. Obviously, we work side by side, and she was just listening to the whole conversation. And when I finally got rid of this guy who continued to try and convince me for fucking the entire length of his stay, she goes to me, you did so well. I have no idea how you maintained your composure through all of that. I would have punched him in the fucking face.
Yeah. Okay.
Story 4.
I will do this one then. And then we will do another one that is also there.
Okay.
Apparently.
Thank you for this detailed story, Hayley.
Yes.
You're very well written as well.
On another transfer, we were called to take a patient to an airport an hour and 30 minutes away. There was some confusion about why we were going to this airport instead of the one in town, and when we arrived to the ICU, the patient was nowhere near ready because the Aeromed team had made decisions without consulting with the hospital or ambulance dispatchers.
Nice.
They also dropped the job on us about 40 minutes before the plane was due to touchdown.
Nice.
So no idea how they thought we would receive handover and load and get down there in that time.
Yeah, what?
This patient was in her 30s going out for a PPM after a diagnosis of long QT syndrome. She had also had an arrest 2 years prior, but for some reason they did not put a PPM in there.
Wow.
She had presented with gastro and they were concerned that she could arrest due to the electrolyte imbalances and the long QT. I was treating and asked what my options were for antiemetics, as we usually carry ondansetron, which was out of the question. Ondansetron and some other medications, they can actually increase your QT interval. So if you've already got long QT syndrome, you don't want to make that worse. They then told me that she could not have metoclopramide or droperidol, which is the only other 2 that we carry, and just use what else I have. I stared at the doctor and said, that's all we carry. It's the ondansetron. I have nothing else, and if she starts vomiting, you've told me she could go into arrest at any point. The doctor basically told me good luck with that and walked off.
Ugh. Love that.
Good luck. You'll be dealing with it and we won't.
Standard.
I expressed my concerns about taking this patient down and was basically fobbed off and told if she didn't go down tonight, she'd be waiting another 2 weeks for the PPM. In the end, I took her down as she hadn't vomited for nearly 12 hours. She was a lovely patient and we had a good chat on the way down. I was watching that monitor the whole way like a hawk though.
I bet.
Yeah, I know that feeling.
In case anyone listening doesn't know, PPM is permanent pacemaker.
Yes, sorry. As we were about 15 minutes out from the airport, I was flicking through her notes to make sure I had everything ready for my handover when an ECG strip caught my eye.
Uh-oh.
I looked at her and said, "Did you have a cardiac arrest in the ICU yesterday?"
What the fuck?
To which she was like, "What the fuck are you talking about?" The
Well, she wouldn't know, would she?
Yeah. The ECG strip in question was several minutes worth of Tosatis de Pointes,
Oh, God.
which for some reason was not handed over to me.
Wow. Non-shockable rhythm, guys.
I've seen that one a few times in Cath Lab.
That's terrifying.
That's an interesting one.
Just a big squiggly line.
Yeah. To make things worse, the patient had no idea her heart was playing silly buggers the day before and thought they were just doing extra tests because no one had told her about it.
Open disclosure.
So she's
What
having
the fuck?
Oh my God.
What? How do you not tell a patient they've had a full arrest?
There was still electrical activity.
Yeah, but that's like
That's not a full...
no pulse, surely. Maybe she did still have a pulse, but she's
Yeah.
like borderline
what I'm
arresting.
thinking.
Yeah, right. And they were
But
like,
even then-
wasn't technically an arrest, so let's just skip that part so they can take her and fuck off.
So Tosatis, I don't even know. I've never known how to pronounce this properly.
I thought you did it real
Everyone
well.
says it differently. Is a life-threatening fast heartbeat condition where the ventricles beat faster and out of sync with the atria. It's usually a complication of long QT syndrome, a heart rhythm disorder that can be congenital, drug-induced, or caused by other factors. Low serum magnesium, low serum potassium. So she's been
probably
vomiting.
had
She's dehydrated
Yep.
as well.
Great.
She's already got risk factors.
Yeah, great.
And she's already got this active
Thing that's
arrhythmia
happened
going.
yesterday.
And she's
What
had
the
a...
fuck?
And that went on for a few minutes as well. That's not just a once-off little run.
I wonder if they gave her some
something.
fucking mag or something to calm it down.
Yeah, probably.
Anyway.
Potassium.
Silly buggers. I love
Yeah, I
it.
know. That was a good expression.
All right, final nightmare story. A doctor who works at the ED I frequently take patients to is so awful and has had a horrible attitude and reputation that even patients will ask, "Is Dr. X on today? I'm not going in there if he is." It's so horrible that our patients are being forced to choose between their health and being treated like a human being. Period. Mic drop. One time, a coworker brought in a lovely old dear after she'd had a fall. He walked over to her in the ambulance offload bay and said, "Another loser," and laughed in her face.
What the fuck?
Wow. Fired immediately. Go to jail. Do not pass go. Do not collect $200.
Because
You're the
she's
loser.
old and had a fall.
Poor thing.
I fall over all the fucking time and
Same.
I'm 28.
You should have seen the fucking bruise on my shin after
I know.
after our little holiday.
Yeah. I know. I
have no idea how I got it. She burst into tears. When the complaint was put in about him, it was swept under the rug as per usual. Another time, I got a needle stick injury and had to attend ED to get bloods done. He kicked up a fuss because the nurses let me sit out in the ambulance right up bay instead of the waiting room as I was in uniform. He then made me wait around 3 hours trying to decide if I needed to go on a course of PrEP. I had no idea.
Just take the bloods.
PrEP is a medication to prevent HIV/AIDS, guys. I had no issues with waiting. It was a busy day and I was low priority, but the patient who I had received the needle stick injury from was low risk and initial bloods had come back clean. The nurse in charge had pleaded for him to clear me so she could get other people into the ED who needed actual medical attention, but he would not come and clear me. He also made me feel like a complete idiot for the needle stick injury, which I was already feeling shitty about.
It's so easy to do.
Oh my God, it's not your fault.
So easy to do.
God, you can be the most careful practitioner and take all the precautions, but unfortunately accidents do still happen.
Because
and
other
there's
people aren't careful.
There's absolutely no need to be a dick about it, period. I've had a needle stick injury.
Yeah.
Have you?
It's
Yeah.
like 4.
Yeah.
Because other people don't put
Guard
sharps
their
away.
sharps. Yeah. Not that I owe him any explanations, but I was called for an off-duty assist, so I wasn't even supposed to be there. The house was dark and cluttered, and the patient and her mother were yelling and screaming at me to give her pain relief. So I was rushing to get it sorted and had accidentally stuck myself during the disposal of the sharp. Poor thing. The working theory is he has blackmail material on some of the higher-ups because how the hell does he still have a job with so many complaints from hospital staff and paramedics and patients?
Money?
I believe it.
Yeah.
It's so sad that in 2025, especially women, we are still trying to be taken seriously because when we do say something, we're brushed off as silly girls who can't handle a bit of a joke.
Even though nursing is a female-dominated profession.
Yeah. Thank you for speaking out about the whole eating your own culture. It's bullshit and doesn't make resilient clinicians, just belittles and burns out those who want to see change in the workforce. It starts with not calling students the student instead of taking 10 seconds to learn their name and continues with just not being a bully to healthcare practitioners to fall into line. I have so many more stories, including being forced to attend scenes I didn't feel safe going into. Also, management can keep their KPIs, but I won't go into that now. I am absolutely loving the podcast. If you're still looking for suggestions, you should look into Graham Stephen Reeves, also known as the Butcher of Bega.
Oh, I might do that one because
Yeah,
I'm looking
do
for
that.
someone.
He's a sicko, and I think he only got 2.5 years for his crimes whilst working as an OBGYN. Can't wait to hear what other stories.
One.
Can't wait to hear what other stories you have for us. Stay Ratchet, Hayley. Oh my God,
yeah.
she signed out with the sign
Yeah,
out.
girl,
I
Stay
love
Ratchet.
it. That was
That's
awesome,
good.
Hayley.
Yeah,
Thank you
nice.
so much.
Very good
I was
stories.
actually so pumped to see this email
Yeah.
because it was so detailed and just so well written. I was like, fuck yeah, we're doing it. This was the email I got and I was like, oh, great, we've got enough. That was so amazing, Hayley. Thank you for everything that you do. And please send us all of your stories because we want to keep going with this kind of thing because it's just so good to know that people go through the same shit that you do and you're not crazy, even though the healthcare system gaslights you into thinking that you are if you have a reaction to their bad behaviour. So, yeah, thank you so much, girl. That was awesome.
Paramedics have personally saved my life twice. They've personally
Oh,
saved
fuck
my
yeah, same.
sister's life 3 times.
Yep.
They saved my ex's life once.
It's what they do. They save lives.
They are fucking lifesavers.
Yeah, and it's a hard fucking job because you are going into the unknown.
Yeah.
Yeah.
Some
it's
of them
like-
are incredibly violent situations as well, I'm sure.
and environments of
Drug
you have to
fueled.
like wade through fucking obstacles in houses and
Yeah.
whatever the fuck's in there
Yeah,
and
there's a lot of hazards.
going upstairs.
Sometimes you
trying to
need
get to
police
people.
with you.
Yeah, and they're trained and educated in transporting patients safely. And you should fucking listen to the paramedics when they say to you that the patient that they're trying to take is not safe for transport.
And why is it fair to put any of that shit on them?
Yeah.
I hate when nurses do that.
They're just like-
oh, I didn't do this or this or this, but you can do it. You'll
Yeah.
have time.
Yeah.
Excuse me? What?
Nursing is 24 hours and you can handball, but like when you're transporting a patient to a different facility, you need to make sure that they can be transported safely.
That is the prime time for a patient to go downhill.
crash. Anyway, we've got,
Some-
I think
for
we've
some
got one more. This
Okay.
is a short one.
This is from Adam.
Hi, Adam.
So I had a bariatric patient with vascular dementia. He was male and had an inverted penis. Didn't expect those words to... Just, okay. I've got the instant image, thank you.
So do I.
Everything he says, I feel it right now. I can feel the warmth of a strange man's penis in my hands.
Anyway, continue.
I was applying pressure to his pubic area to pop out his inverted penis. So as to aid him in using a plastic urinal bottle. Don't you love that?
Fair enough.
Let's just go for a dig.
Yeah.
We're just going to excavate the penis. The patient squeezed his thigh. Oh, God.
What did he do?
Patient squeezed his thighs to hold the urinal bottle before I was able to move my hand, and my thumb got caught between his thigh and the bottle.
Nice.
As my thumb was being squashed, I pulled and it dislocated my thumb,
What the
snapping my UCL at the same time. 7 months later, I am still recovering and I have to have another surgery as the bones are not aligned properly and I have nerve pain. Kind regards, Adam. Well, Adam, thank you for sending kind regards, but I'm going to send you even kinder regards because holy
iconic.
fuck, that sucks.
Imagine the story of the
Holy
tell.
shit.
Every time you go in to
Yeah.
get like work done on your fucking thumb, oh, I got it stuck between a cock and a hard place.
Literally. I hope it wasn't too hard places. Otherwise, I'd be even more worried.
That is such a funny story. Imagine.
That's a great one.
That is so good. It's a great one to finish on. Unfortunate, Adam. I hope you heal quickly. We're not making fun of bariatric patients. It's just funny. It's just funny, okay? Jesus. It's just hilarious that he broke his thumb on an inverted cock. I can't. That is just so funny.
He broke his finger.
Yeah.
He actually broke it.
Yeah. On a cock. On a cock and a urinal.
You have had a once-in-a-lifetime experience.
I know. How many others can say that they've broken their thumb on a cock?
I like that.
I love it.
That's great.
Amazing.
Hold on to that forever. You'll never live it down.
Well, thank you all for your beautiful, lovely, hilarious and scary and nightmarish nursing nightmare feels.
I can't stop having like OCD thoughts thinking about my psych placement and how all the old men used to just fucking jack off in the bathroom with the door open. Then they'd be like, hey, nurse, is dinner coming soon? And they're just like...
Jacking off at
Yeah.
you. Yeah, it's a thing.
It's good.
It's all part of mental illness, isn't it?
And I'm like, just checking everything. Yep, everything's
All is good.
okay.
Great.
He's fine.
I'm just gonna go. Yeah. Have fun with whatever you're doing.
I'll come back in like 40-ish
It's hilarious trying to stay professional when you're faced with a man pulling his cock.
They've literally jizzed and you're just like...
Great. Feel better?
Lunch is in 20
Awesome.
minutes.
I'll go get your meds.
Fucking soon, yeah.
Anyway, if you've got a nursing nightmare fuel, please send it to nurseratchetpodcast@gmail.com. Please send us your stories because we want to make this a series. Yes, do tell. Do tell.
Tell us, please.
Help
We
us
wanna
not feel
know.
alone.
Surely that's not the
Have you ever had your thumb broken between a cock and a hard place? Please tell us. Please tell us.
Yeah. Yes. Ever brushed your hand past a man and he's going, oh, don't take it away.
No. Can you undo my cock buckle?
Yeah, right? Oh, I can't wipe.
You need to wipe.
What do you mean you can't wipe? You wiped before you got here. So.
Oh my God.
Oh.
Can you help me to the bathroom when they're fully ambulatory?
Yeah.
Take advantage. Go for your life. It's not like we have a soul.
Oh, yeah, we're not fucking dumb, though. We know what you're doing.
We know what you're doing. Anyway, leave us a comment. You can comment on Spotify or you can leave us a comment on our Instagram posts that corroborate with every episode. We like to put pictures up and such.
She likes to corroborate.
We do. So do comment or send us a DM at Nurse Ratchet Podcast on Insta. Follow us on Insta, please. We want to get our followers up and you will get updates about each episode on Insta. And yeah, send us a DM. We love you.
Bye.
Keep it ratchet.
Thanks for joining.
Signing out.